Thanks for joining us this morning and Happy New Year to everyone. My name is Shelley Stein and I am the chair of the Genesee County Legislature. And joining me again this morning are Matt Landers, our county manager, and Paul Pettit, our public health director. We wanted to provide you this morning with another community update regarding our COVID data, and we appreciate the media push in helping us to get the information out to our public. Most of all today, we wanted our update to focus on the vaccination. As you know, there has been a whirlwind of information of late from the governor's office, which in turn has led to our phone lines being inundated. I'm going to leave most of that to Paul Pettit, but Matt Landers will also be chiming in shortly and including information as it pertains to our new vaccination schedule. I'm going to focus my remarks on our county workforce, who I just mentioned to you, and they continue to be inundated with calls from residents about getting the vaccine. The silver lining here is that it seems that there's an overwhelming number of people who want to get the vaccine, and that's good news because the more people, the better. Since November, thousands of COVID tests have been administered at the Genesee County Emergency Management and Fire Training Center. And this has required many hands on deck. The untold volunteer hours that are being given and given freely by the staff of Genesee County and also community volunteers is nothing short of heroic. It has been an incredible demonstration of the commitment, all in the name of protecting and promoting public health and our community, which in turn resonates in our economy. And I think that Matt would confirm this, but to a person, we have not heard one employee complain, and they continue to volunteer their time and perform their work functions, not only as good public servants, but as good neighbors and concerned citizens. I look forward to the day when the pandemic is behind us and we can celebrate and recognize the hard work and the volunteerism of this county workforce and this county community. I thank you. And with that, I'd like to turn the program over to Matt Landers. Matt, good morning.
Good morning. Thanks, Shelley. I'm just going to have a few comments, a few notes, and then I'll turn it over to the man with the answers, or as many answers as we possibly can have in this time. We're constantly using the analogy or the saying that we're basically we're flying, we're building the airplane as we're flying it, and that's a reflection of the information that's coming out to us and the data and the resources that we have that we're piecing together for not only our testing but our vaccination side. One of the questions we continually get is the color of the zone that we're in. And just want to touch on that real quick, that we are still, Genesee County still has parts in the yellow zone that were initially placed in the yellow zone for about a month now. And that is primarily around the city of Batavia, some parts of town of Batavia, but there is no orange designation. The numbers have been trending down a little bit better very recently. We're no longer leading the state, much less the region, in positivity rate. So we are now settling down below a 10% level, which is still quite high, but it's better than it had been and better than some of our neighboring counties and the numbers they're facing. So we are still partly in the yellow as we have been, no increase to orange, and fingers crossed that we will continue this trend and hopefully get out of the yellow zone at some point in the future. But it's something that continually gets asked of us that I wanted to touch on. I want to echo Shelley's comments on our workforce and the volunteers from our community. It is very heartwarming. It's a silver lining in this pandemic to actually see the all hands on deck of our workforce from virtually every county department as people that are volunteering their time, reassigning to the efforts over at the testing clinic and at the vaccination clinic that will be standing up. Speaking of the vaccination clinic, it is going to be, the plan is to bring this online on the 20th of January, which is next Wednesday. It's an aggressive timeline, but we are working with emergency management and the health department, and we feel like it is going to be a possibility Again, we're going to need all hands on deck. We're going to rely heavily on our very dedicated county workforce to have them reassigned to some jobs over at GCC, where the testing or the vaccination clinic will be, along with community volunteers. We can't thank people enough for stepping up, and we're going to need more of that. It's going to be a sustained effort for several months, at least, we anticipate. So we're going to need people to step up and help us out. We'll be doing this on a Monday, Wednesday, Friday rotation for Genesee County, and it will be 9 a.m. till noon, and then from 2 to 5 will be the times that people can come and we'll pre-register, and their time slots will allow them to get vaccinated during the 9 to 12, 2 to 5 time frame over at GCC. I want to thank Dr. James Sensor at GCC, the president, for allowing us to use that facility. It is an ideal facility because of its size. It is great parking, wide open. Everyone knows where it is, and it's an ideal location. It's been a targeted location for a while for Genesee County for things like this. But at the same time, it's just, I just want to definitely put my gratitude out there and thank Dr. Sensor for working with us on this. We know that we believe spring sports are going to be going on over at GCC, so we're sharing some of that space. So we know this is definitely a challenge for them to allow us to use the space while at the same time meeting their own needs. So it definitely is very grateful. And again, as far as looking for volunteers for helping us out, if you want to step up and volunteer and help, the phone number you can reach us at is a 585 number. It's 344-2550, and the extension would be 2204. And Dickie is the coordinator here in the manager's office of compiling the listing of volunteers. What we would ask for, the only thing we're really looking for is we don't want somebody that would just volunteer one time. Yeah, it ends up taking more time to train somebody. So if somebody consistently wanted to donate and volunteer every Monday, Wednesday, or every Friday for the next few months, that would be greatly appreciated. So by all means, I hope that more people will be able to step up and help us out. With that, Paul's got a lot of great updates on the vaccination efforts, on what's going on in Genesee County and Orleans County, and I'll turn it over to Paul.
All right, thanks, Matt, and good morning, everybody. Thanks, Chairman Stein, for your comments. As I get going, as we do every time we hold these briefings, I do want to continue to reiterate and echo the sentiments by our chairman and county manager to our public health workforce and for our volunteers. I don't think we can say it enough, how grateful we are for the efforts that you put forth in helping us during this challenging time. I specifically shout out to my public health staff, and I'm going to continue to do that. They come to work every day and they work hard, and they do their best to provide the best service they can to our residents. And, they definitely, I think, are worthy of that recognition and continual praise for their efforts. So, but it is taking a lot of efforts and a lot of volunteers to make this happen, whether it's been the testing and now moving into the vaccination stage of this pandemic effort. And we're going to continue to need folks to step up and help out. This is going to be a prolonged time for us. It's going to be a many, many months effort, probably through midway or more into 2021, to meet the needs of getting vaccine out to our folks in the Genesee and Orleans region, essentially around 100,000. So it's going to take some time, and we're urging as much patience as we can. I'm going to talk a little bit about the current state of vaccine in our counties in a minute. But as you'll see, the numbers of availability did not meet the numbers of eligibility. So it's something we'll talk about, and we'll continue to try to explain as best we can. Before I get into that, though, I want to talk a little bit about just a quick snapshot on numbers. And again, we continue to put out our daily press briefings. So hopefully folks have an opportunity to review those, and you can really see the number of positives we have on a daily basis, those type of things, and keep track of where we're trending and what's going on. But just real quick snapshot, regionally, again, in the Finger Lakes region, the 7-day rolling average is at about 8.7% for a positivity rate. The 14-day is at about 9.4%. So again, regionally, still hovering right around that 9%. We have seen a little bit of a downward trend overall as a region the last week or so, which is good news. So we want to see that continue to trend that way. Hospitalizations, which is still a major concern for us in the region, making sure we have bed capacity, still hovering around 0.07% for our region. So honing in a little bit, looking at Genesee, our 7-day average is at 9.7% and our 14-day is at 10.8%. And for Orleans, it's at 9.2 for a 7% and a 9.8 for the 14. So again, with those numbers, you can see we're just slightly above average here in the Finger Lakes region with Genesee and Orleans. So again, higher than we want to see them, but you know, they haven't really been going up, which is good news. We want to see them continue to trend hopefully downward. Hospitalizations in the counties continue to be something that we monitor closely. And when you look at our numbers right now, and we report current positive cases that are in the hospital, once again, we explained this on a previous press conference. Once folks are no longer considered in isolation, we don't continue to follow them for hospitalization purposes. Does not mean that they're not still in the hospital, just that they're not captured in our daily numbers. So for Genesee County, we currently have 16 of our current active cases in the hospital. And for Orleans, we have 14 of our current active cases. Going across the line real quick, just for some general numbers, so far Genesee County has had 3,184 positive cases and with 72,140 negative, and our current active cases are 227. And again, unfortunately, 37 deaths attributed to COVID, with 2,515 recovered. For Orleans, we've had 1,783 positives, 38,188 negatives, 254 current active cases. Again, 64 deaths attributed to COVID and 1,281 now in the recovered category. So there's a quick snapshot of numbers. And again, I'd encourage folks to follow along either on the New York State Department of Health website, which again, we put in our daily briefing, and that's going to provide you with a quick snapshot of raw data if people want to follow along there. And again, you can see the 7-day, the 14-day by region, by county. It's a great resource to look at. But in addition, you can follow along in our daily briefings as you would like for those continued updates. So Matt mentioned cluster zones. Just real quick again, Batavia, city, town are still in a yellow zone. There's been no change on that. No additional declarations or additional color changes for those areas and or any of the other zones in our counties, which is good news. It does continue to appear that the governor may be moving a bit away from the color designation process. As we've talked about many times, as I just went through the numbers, pretty much the entire Finger Lakes region and probably the state would qualify to be under some color designation under the criteria. So, you know, we're very pleased not to be flagged and color coded. The concern is still for a lot of us that are yellow, and even more so for those that are orange in Monroe and Erie County. How do you get out of it? There isn't really a good path forward in how to get out of a color designation once you've been placed in one. So those discussions and trying to understand that process a little better from the state is still underway. Just a little bit on the school testing in the yellow zones. As we reported, when you do get color designated yellow, any school buildings that lie within those zones have to do testing of 20% of their population. That includes staff and students. So all of our schools have completed their 20% testing, and they have all tested out. In other words, what they tested internally have all been below the positivity rate within that zone, which is not overly hard when it's well over 10, 11, 12%. So we're very happy that they've been able to test out. Essentially means they no longer have to do ongoing testing moving forward. So again, good collaboration with the schools. You know, again, a shout out to the superintendents and staff that have worked hard to get that testing done internally. And again, we continue to work with them on a weekly basis to try to make sure information is flowing back and forth between the county and the schools. So that's another check that we got done, and unfortunately, we don't have to continue testing currently in those yellow zones. Also, just a little bit, we've talked the last couple of weeks about some of the delays in contact tracing from the state. I just want to mention that briefly here again, Just a reminder on the process, again, internally, the health department staff are doing the case investigation. So when we get a positive case, my folks internally are doing the initial investigation, talking to those positives, understanding who their contacts are. And then at that point, they get turned over to the state, and they're part of the state contact tracing system. They're working alongside the counties. They're not county employees directly, but they are collaborating with us, and they're doing the quarantines, the direct contacts. So again, there might be a slight delay there. Again, it varies, it seems, but we have had many conversations over the last week with the state over concerns on delays. And I do know that they are hiring and adding more capacity into that to try to speed that process up. So again, the biggest thing I would ask for folks is if you've been identified as a contact from the positive directly, or you may be on quarantine, just to start that quarantine process. You will be contacted hopefully as soon as we can, through the state contact tracing system, and you'll get your papers, your official orders through that process. And again, if there are any problems or issues, you can feel free to reach out to us, and we'll help to try to mediate and work through that process. But just again, a reminder, there still may be a delay, but the contact will be coming. All right, so I want to spend most of the time here just running through some vaccine numbers and issues, and I definitely want to leave plenty of time for questions because I'm sure there's many out there, and we'll do our best to answer those when we get to that. But just real quick on the vaccine efforts, I want to again start here by saying that we simply don't have enough vaccine. I don't think we can say that any clearer. You're hearing that from the state level, from the regional level. We've been putting it out as best we can locally. The bottom line, the supply chain, the vaccine coming to the state, coming to the region, coming to us at the county level is just woefully inadequate, so to speak, for the current number of folks that fall in the groups that are eligible to receive the vaccine. So it's very important for folks to understand that this isn't a lack of desire. It's not even necessarily a lack of potential ability to deliver the vaccine. It's really a lack of the actual vaccine itself. And I think that bottleneck's going to continue more than likely for a few more weeks, and I'll talk a little bit more about that. So eligibility doesn't mean availability is, I guess, the bottom line. Just because you're eligible now doesn't mean the vaccine's available. And as we know, as we headed into the end of last week, we were in the 1A category. So we were focusing on, again, that bucket, mainly our healthcare personnel, EMS, EMTs, paramedics, front-facing providers. That's really the group that we've been working on. The expectation heading into the end of last week and what we knew was 1B groups were projected to open up near the end of the month, potentially early February. And as we all know, the announcement came from the governor that he was opening those up starting Monday. So again, we reacted to that. That added in about another 8 to 10,000 or so folks eligible in Genesee and another 6 to 7,000 in Orleans. So that created a lot of angst and frustration into the system starting on Monday. And then Tuesday, he added in new people into the bucket of 1B. Used to be the old 1C bucket, basically. So essentially what we have here is we had a significant, overwhelming amount of folks that now qualify that previously did not qualify. If you look at the number, and again, these are kind of state projection numbers in these buckets. These aren't exact, but you're well north of 50,000 people now that are eligible in Genesee and Orleans County. So well over half of our population technically can get the vaccine today as we speak. So that shift just opened it up to a lot of people, and and rightly so. People said, "Hey, I'm eligible. I want to get vaccinated. So where do I sign up?" So we've been working through that process, getting a lot of phone calls. I can tell you by calling isn't going to get you an appointment any faster. Our folks are responding to these phone calls as quickly as we can, but we can't sign you up. We can't get you an appointment. There's just not vaccine. So we really need to urge patience and understanding is, we locally are trying to respond to the heavy demand without the vaccine to deliver at the moment. Also, I just wanted to note, we had a press release earlier this week that went out that talked about approximately 200 doses in the county. I just want to clarify that a little bit. That is the doses that the county health department had received. So backing up a little bit, the way this process has worked, we have this regional hub that the governor has put in place, which is headed by URMC for the Finger Lakes region. They're in charge, so to speak, of vaccination efforts and allocations in the region. Every region has their own hub. And vaccine originally went to the hospital and the federally qualified health centers in our counties. The county, the health departments, we were not involved in any of the kind of the front end of this as far as receiving vaccine or being part of the distribution plan. The original idea was the healthcare systems and the FQHCs were going to take care of the 1A buckets, and we were going to come on board a little bit more with 1B when we got to more of the community side. Unfortunately, the distribution locally and around the region across the state was not as robust as I think the governor had hoped, especially getting vaccine in the arms of folks. So that process sped up, and again, local health departments were brought into the table and able to start being able to receive vaccines, which is what occurred. So again, we started getting vaccine. Our initial allocations were 200 doses. And we have set up clinics through the end of this week, and we're going to be out of vaccine at the county level by Friday, so to speak, with the vaccine that we've received. The hospitals and our FQHC in the community have also been very active in getting out the vaccine that they've had. So again, it's not an issue with getting the vaccine out; it's more an issue of the actual having the vaccine. Locally, just to give an idea, we've received about 1,200 doses into the community side. And when I say community, just to clarify, the nursing homes, those are not included in that. That's been getting completed, as I talked about last week, by a federal program using pharmacies that have been going into our nursing homes around the state. I know that they've been into our Genesee County and Orleans County nursing homes, and I believe they're starting their second round. We don't have any detailed information on how many have been vaccinated out of there, and that included staff and residents. But that program's separate from what we've been doing on the community side. And also on top of that, the hospitals and the FQHCs also received a private bucket of vaccine to vaccinate their employees. So that was all taken care of kind of in a separate allocation. So the doses that I'm mentioning here, the 1,200 for Genesee and basically 1,000 for Orleans, are the ones that have been available for the public-facing 1A group and now 1B group. So at this point, we have not received any new allocations. We put requests in, and the way this works is whatever the vaccine receiving entity is, whether it's a provider, whether it's a pharmacy, whether it's a hospital, health department, you put your requests in the week before, and based on the allocation that comes from the feds to the state to the region, you get your allocation to the county. And they're picking and choosing of what locations it goes to. So there's really no local control in this. We're putting our requests in. Everybody's putting in the requests, but we're only getting a little dribble, of what's coming out to us. So again, it's taking a bit of time. So far in the region, there's been 78,000 approximately doses to the Finger Lakes region. Our allocation for 78,000 doses to the state, or in the Finger Lakes region since the beginning. The allocation to our region this week was 8,000 doses. So the Finger Lakes as a whole only got 8,000 doses. Genesee County, 400, Orleans, 200. So that's what came into our counties this week. And again, those have all been kind of already pre-booked up into existing clinics. So again, just trying to reiterate, although folks are eligible, the availability and the ability to push it out is just not there. So we're doing our best with what we have, and that's what's creating the backlog again. So just a little bit on how folks can sign up, and we do have on our county websites, folks can go there and click on a link, and it's showing all the available clinics. And again, I can tell you right now, they are all full, whether they're through us, whether they're through Oak Orchard or through the hospital health systems. There's really nothing available, but we'd encourage you to keep looking back. If vaccine happens to come, we will add on new clinic space. There's no residency requirement when it comes to vaccination, so I would also encourage folks to look around, to surrounding counties. As long as you're in the eligible group, you can sign up for available slots. I have heard of people it's kind of like the lotto right now. You sign up and you may be able to get lucky and find a spot. No guarantee on that, but unfortunately, it's kind of this guessing game where you got to constantly keep looking for available locations. But we would encourage people to keep trying. The other option that we would like folks to do is continue to visit the COVID-19 New York State COVID-19 vaccine webpage. That is a great resource with information, whether you're looking to see if you're in a eligible group, which again has continued to expand. And again, I can't take the time necessarily to go through all that, but I do believe we're getting some links posted up in our chat, which should be helpful for folks if they want to repost those or share those. But I'd encourage you to go to these websites and determine if you're eligible. When you go to there, there's actually a process where you would go through an eligibility tool, and at the end of that, it would show available clinics within 100 miles or so of your location. The other thing that we would like to note is there is a 1-800 number that people can call around vaccine information and getting registered that has been posted by the state. That is a 1-833-697-4829. And again, maybe we'll get that posted in the chat too. Just keep in mind, if people are calling this is for the state vaccination sites. This is not for local registration. Just so everybody's also aware, at the moment, there are no local state sites doing vaccination. The state is in the process of standing those up. We haven't heard fully the detail of where those will be. I know there's talk of potentially one at the Dome Marina in Monroe County. We have not been made aware of any local vaccination sites, kind of deja vu of testing at this point. So, but we're going to be at the front end of that. We're going to start vaccinating locally so we can make sure we have local access for our folks. All right, so again, collaboration between the health systems, FQHCs, and us to get the vaccine out at the moment. Pharmacies are coming online. We do believe there's some allocations going to our pharmacies in our counties in both Genesee and Orleans. We do not have all the full details on that. They're kind of under their own umbrella. They've signed up to be a vaccine recipient and vaccinator location. But they're responsible once they receive the vaccine to again get the word out about when they're going to start advertising or how they're going to make appointments. So we are trying to communicate with them a little bit, but again, that process goes through the pharmacies. When it comes to the healthcare side, this is again a bit challenging, but they are reaching out to their patients when they have vaccine. So again, we'd encourage people to be as patient as they can. Whether you're potentially hearing from your healthcare provider. To potentially come in and get scheduled for a vaccine. We know at UMMC, part of Rochester Regional, they're collaborating as part of a healthcare system to do some drive-through vaccinations for their population 75 and older. Again, a very small number, about 50 a day or when they get their allocations. And this is not something where you can make an appointment, you can't call. They're randomly generating folks and they're calling them directly and telling them a time to show up. So again, the process is a bit challenging and it's being developed and ongoing as we go along. So again, patience and understanding, and we're doing our best to get that out there. Refer to the websites as best we can, get folks there to review if you are eligible now. And then also we do know that the 16 to 64 group has been moved in if you have medically some type of underlying health issue or immune compromised. The state has not put out guidance yet on what that really means as far as who would be eligible under those criteria. So as soon as that information comes out, we'll make sure to push that and get that out to everybody. But those folks that may fall under that, they'll also be eligible in the 1B group, including the 65 and above, in addition to all the different professions and careers that fall under that category. So as we move forward, again, as Matt was mentioning, we are in the process of standing up our public pods. At the moment in Genesee County, we will be over at GCC, and the plan is to hopefully launch mid to late next week, vaccine dependent. So more information to come on that. And then we will be hopefully there Monday, Wednesday, Friday, indefinitely, as long as the need is there to do vaccinations for our residents that, again, qualify. In Orleans County, we're going to be vaccinating on Tuesdays and Thursdays. We're still finalizing the location, but it'll run very similar to the Genesee County Public Clinic. So if you look for our 2-county region, we're going to be doing vaccinations 5 days a week and hopefully vaccinating upwards of 600 people per day. It all depends on, again, volume and throughput opportunity here. So more to come on that, but it will be here. Unfortunately, I think the biggest challenge we're going to have is, again, the vaccine coming to us in a reasonable time so that we can make sure get it out to the folks. But we will be ready on the county side to deliver it. We just need the vaccine to come. All right, so I rambled a little bit on some things, and as I said, I wanted to have plenty of time for Q&A, so we can hopefully get some answers to some of the questions folks may have. So I'm going to turn that over now to questions, and what I guess I would ask is typically what we've been doing here. If you want to ask a question, unmute yourself, just identify with what affiliation you are, and state your name and your question, and then either myself, Matt, or Shelley will do our best to answer it. So we'll turn it over now. Thanks.
Dan Fisher at WBTA.
Hi, Dan.
I think it was last week or perhaps the week before, you estimated that the number of 1B persons eligible was something like 13,000 in Genesee County. It was quite high. And at the present rate, that's just going to take forever to vaccinate. What do you see in the tea leaves for getting more doses into this area?
Yeah, no, it's a great question, Dan. We're all feeling that pinch. I mean, we're not alone locally, and I think there's just been such a high expectation, that the vaccine, was getting approved, late November, early December. There was a promise of 20 million doses by the end of the year, and that would just continue to flow. I believe it is getting produced. It's really a pipeline issue and getting it out. The other potential good news is here. Remember, there's other manufacturers, AstraZeneca, Johnson & Johnson. They're both in, their stage 3 clinical trials, and hopefully they'll go through the same process of Pfizer and Moderna, where they'll get hopefully FDA emergency use authorization here within the next month or two, which will again put more volume into the pipeline potentially for us to have access to. The bottom line is even though it's been approved for about a month now, it takes time to produce and to get it out. And this is a historic, unprecedented vaccination effort, unlike anything we've ever seen in our country, and probably, hopefully, we'll ever see again. And it's going to take time. And I guess that's why we go back to the patient's end. And the other thing, just to keep in mind, we have to do this twice. So we're doing our 1A groups right now with Moderna, which is what we're using in Genesee and Orleans County. We have to revaccinate those people on day 28. Right, so it's going to slow down even a little bit the progress of vaccinating more folks, as we have to revaccinate with that second dose to get up to that 94-95% efficacy with the vaccine. Bottom line, I think as we go forward, the expectation is they'll get more supply into the system, into the chain, which will then be able to receive locally. You're going to have pharmacies, you're going to have providers, you're going to have our public clinics. All up and running, and so hopefully the availability at some point will start to balance with the eligibility and the requests, and we'll get to where we need to be so that everybody that wants the vaccine is going to be able to get it. Keep in mind, the governor had said with 1B, they expected the 1B group to take about 14 weeks. That was before he added in the 65 up and the 18 to 64 group with underlying health conditions. So that time frame probably more than likely got extended by that happening. But bottom line, I guess all I can try to articulate is we're going to get it out as quick as we can. The goal is not to have us be the barrier. We want to make sure we have the systems in place to be able to get the vaccine to folks when we get the vaccine. So it's going to be more hopefully a supply chain issue that'll work itself out in the next few weeks.
Hey, Paul, Jeff Petralba, Channel 2 News in Buffalo. Could you maybe explain for people, if there's a senior out there who, is trying to get the vaccine, what would you recommend they do, or anyone who's eligible, what would you recommend they do to try to get an appointment? I know you had mentioned about, calling, that's not really going to help you, and you can look at other counties and things like that. What would you recommend they do?
Yeah, so, again, we appreciate the frustration and challenge. We know, especially our senior population, we know are the most vulnerable, right, that we've seen throughout this pandemic. COVID has hit them particularly hard, especially 75 and older, and those in our, long-term care facilities. So we want to make sure we're still prioritizing those folks and getting them vaccinated as quickly as we can. Again, each county, I believe, is setting up some processes as far as local numbers that folks can call. In Orleans and Genesee County, we're working with our Office for the Aging to help facilitate the process of, getting information and helping to register. Again, the problem is the vaccine and the availability of the clinic space is really the issue. With the higher senior population, again, as I mentioned earlier, healthcare providers are the plan, again, through the state, is that those folks and are going to be reaching out to their patients. And again, it's depending on vaccine. So hopefully your provider will be reaching out to you at some point. Again, I would caution to start overwhelming them with phone calls. They don't have the capacity to handle those, just like we don't. I think it's more of one of those, we're going to have to stay tuned. We're going to have to continue to articulate as best we can on a regular basis to the public of where we're at with our vaccine numbers and where these folks can go. And I know it's frustrating. It's a bit of a challenge right now, but we're doing our best to try to manage that. We do know that the hubs are setting up potentially some additional call banks, potentially using 211 and some other community resources to help field calls and field questions on vaccination locations and the process of getting registered.
Paul, Dan Fisher again. There is this bottleneck. I mean, with all of these millions of doses that are being prepared across the country, but yet I got this right, only 400 doses received this week in Genesee County. Where is the holdup? Is it at the regional level? Is it at the state level? Is it at the manufacturing level?
Yeah, so, I think if you look, it's mainly up chain, I guess, is the answer. So I know it's not local, and I know regionally it's not regionally, right? I'm on daily calls with the Finger Lakes region. Everybody's in the same boat. No one's receiving a lot of vaccine. As I mentioned, this week, the allocation for the Finger Lakes region was 8,000 doses for the whole Finger Lakes, the 9-county region. So we're all in the same boat on this. Again, the state had been receiving, I haven't heard their allocation for this week, but early on it was 300,000 doses per week. So again, this is an issue you got all 50 states in the country all seeking their allocation demands. So again, there's a bottleneck in the back end. I believe the manufacturers are pushing it out as quick as they can. But ultimately, hopefully that bottleneck will start flowing a little quicker here. I can't speak to the specifics on, again, the high level view. I just know locally and regionally, that's not the issue in the system.
I think there may be some questions here about what has been done up to this point in terms of vaccinations. And we know we still have a whole lot more to do, but what's been done so far in 1A and 1B?
Yeah, so I'll be honest with you, we are still finishing up the 1As, right? So if you look at the prioritization groups, those, again, the first responders that qualify, the front-facing medical personnel, behavioral health, I mean, those ones that were kind of in those original 1A groups, that's been the priority. The OPWDD groups, anybody, the residential group homes, all the way through at the moment. The 1B, opening it up to additional folks, has just flooded more into the system. Again, as I mentioned earlier, the expectation was we weren't going to be opening up the 1B potentially for at least another week or two now. The prioritization group is still 1A, but it doesn't mean that 1Bs don't qualify. And if they find appointments, obviously they'll be able to get vaccinated. But again, this is really, the whole idea here is risk-based. We wanted to try to protect, again, those that have been hit the hardest from COVID, which again is, our seniors and those that in our congregate long-term home care settings, and then our healthcare workers, which was the whole prioritization group with 1A. We're still moving through that process, and we want to make sure that those 1A groups are as completed as they're going to be. And to keep in mind, not 100% of these folks are taking the vaccine. I'm hearing from different settings, from anywhere from 60% wanting it up to 70, 80% wanting it. So again, the number isn't 100% always. It's going to vary a little bit per population of those that, want the vaccine at this point in time.
Yeah, we've heard about those issues of, some still having questions about the timeline of the vaccine, whether they want to take it or not. But would you say, by and large, have most of the nursing homes at this point been vaccinated? And do you have a percentage of how many healthcare workers?
Yeah, so on the nursing home side, as I mentioned, we don't have the numbers. I mean, the state has really been overseeing that process. So I guess we have to check over on the state side on the numbers. I do believe they are starting round 2 because we know that they were using the Pfizer vaccine, which is every 3 weeks. The original goal by the state was to vaccinate all the nursing homes in the state within the 3-week period and then redo it again there with their second doses. So I know locally, again, they've been in our nursing homes, but I don't have numbers on exactly how many residents and or staff were vaccinated. You know, and on the healthcare side, again, I don't have that number offhand of exactly how many have taken it. From what I have heard, though, it's a good, you know, it's a percentages in the 70s to 75% locally of our healthcare workers. And I think we're hearing more and more of them are signing on. There may have been some hesitancy in the very beginning, and they said, well, I'll wait. But I think as now we're getting more into it, more of them are signing up to take the vaccine.
And do you know how many people are eligible? Forgive me if you already mentioned it, but how many people in total are eligible in Orleans and Genesee County?
Yeah, so I did mention that it's over 50,000 folks, and again, these are kind of by the state bucket numbers. But if you look at the new criteria, it's well over 50,000, so over half. And I think that's probably pretty consistent if you look at any county proportionally, you know, just based on the priority groups that have been authorized and are now eligible. So it's over 50,000 people in Genesee and Orleans.
Over 50,000 eligible, and you had mentioned about 400 doses in Genesee and 200 in Orleans County.
That were received this week. Yep. So the allocations that came, new doses into the county is what I'm talking about, new doses, right? So we already had some from the previous week, but new doses coming in, that's correct. 400 in Genesee and 200 in Orleans. And again, so far, community facing, excluding nursing homes and healthcare workers, Genesee's vaccinated about 1,200 and Orleans done about 1,000.
And is that about what you're getting per week? 400, 200, or somewhere in that ballpark?
Well, it's early. We just got our first doses last week, and that was the 200 that the counties received. We did put in requests for this week, but we did not get any allocated to us. We have requests in for next week, and it's a week-by-week process, so we're not sure exactly what we're going to receive next week. The hospital's not sure, the FQHCs aren't sure, the pharmacies aren't sure. It's literally, we put our requests in, and based on what comes into the state, to the region, to us, is what comes in.
Hey, Paul, Howard Owens at the Batavian here. Can you hear me?
I can. Hi, Howard.
Hey, Paul. So I got a few questions. I want to start out, though, and I apologize for this. We had some technical issues here. We are live streaming, but missed the first 20 minutes. And I guess you discussed kind of the downward trend of positive cases. I wanted to maybe hit on that again. And do you have any speculation as to why we're seeing a downward trend?
All right, so let me clarify the downward trend. This is not like going down a mountain where we're dropping fast. You know, you got to remember our positivity rates were up at 12%-ish. You know, we were unfortunately leading the region, and at some point almost worse than the state at one point, kind of mid or late December. So when I say downward, again, as I shared those percentages, you know, we are down a little bit, you know, still hovering around a 10.8% on the 14-day average and 9.7 on the 7-day average. So you can see that's coming down a little bit. You know, so again, I would surmise that a little bit has to do is we're moving past the traditional holiday season, right? So typically going into Thanksgiving and through holiday, potential holiday gatherings, which we obviously did not encourage this year, into the holiday season with, you know, the different gatherings that come. We're now on the back end of that. You know, we're out almost 2 weeks now from the New Year's, and typically with that incubation period. So I think that's probably lending itself into that a little bit, that we're now working ourselves back into hopefully a little bit better of a smaller positivity rate. But, you know, I mean, I think that probably has a lot to do with it at this point. But still higher than we want to see them. I mean, we'd like that to continue to trend down for sure.
Thank you, Paul. And I appreciate you taking questions about the vaccine. I realize that, you know, a lot of what's going on is higher up the chain than what you have any direct control over, but you are our conduit for information. So any concern, I guess the vaccines have some sort of expiration date. Any concern with the bottleneck that vaccines that have been manufactured aren't going to get to us quick enough?
I don't think at this point that's going to be an issue. The Moderna vaccine that we've been receiving locally, the expiration date, I believe, is in June. It's like 6 months, and we're getting it out the door as quickly as we're getting it. So I'm not overly concerned with expiration dates at the moment. That could change, I guess, over time. I guess if we go the other direction where there's so much vaccine and there's not enough capacity to deliver it, right? So if we invert things, but at the moment, I think the availability and the length of the expiration, there isn't any issues on that.
Are you hearing anything or seeing anything that gives you hope that these logistics issues will get cleared up as the supply chain gets better and we'll get a faster?
Yeah, well, I mean, we got to live on hope here, right? The reality is this is new. As I mentioned earlier, this is an unprecedented effort. We're tapping into systems and processes here that we've never really done on this scale anywhere in this country. I'd like to think, and I do believe, talking to our hub as they're getting their legs underneath them and all the counties are getting their legs underneath them, standing up these ongoing long-term clinics to meet the demand, that once everybody the system kind of equalizes and everybody gets their legs underneath them, that hopefully it'll be running a lot smoother and there won't be a lot of issues with folks unable to get vaccine, whether it's here locally or in surrounding counties.
With distribution so far, are you satisfied with the level of willingness to accept the vaccine?
Yeah, no, I think what we've seen so far is I mentioned earlier, it ranges a little bit, but overall, I mean, I'd say it's well over 75% of the folks in those buckets are taking the vaccine if they have the opportunity. There's definitely not a shortage. We have, as I said, the phones are blowing up, and with 50,000 people eligible, there's a lot of people. I mean, if you went at that percentage, I mean, you're still talking 40,000 that want it out of that. So again, it's a big number, and we're going to try to get it to them as quick as we can.
On testing, you've been doing the drive-through clinics. How are those going? Are you still getting good positive turnout? Are you satisfied with how that's going?
Testing has been amazing. I can't again reiterate enough the collaboration and the work being done by the county workforce and volunteers that make this happen for our residents in both counties. We've literally been testing over 500 people every time we test. So between the two counties, sans the holiday week, we only did one day in Genesee County just due to the holidays. We've been testing over 1,500 people per week in our two county region. So that's a lot of tests, and it's gone very smooth. And we've been identifying typically anywhere from 30 to 40 positives every time we do those events. So the positivity rates kind of fluctuated between 5 and 8 to 9%. They've been very successful. And, frankly, I think it's an operation that is hopefully going to allow us to roll right into vaccinations, right? So the same, type of need and volunteers and that collaborative working arrangement. I think if anything, it's kind of help us cut our teeth on the needs and how we're going to be able to work together to meet this need.
Great, Paul. Thank you very much.
Paul, it's Jeff again. Could you enlighten us on whether pharmacies are starting to get it, doctors' offices, grocery stores, obviously you guys have it, but there's supposed to be a lot of other partners also. And where does that stand?
Okay, yeah. So 1B, when that opened up on Monday, the governor also opened up the ability for other entities to receive the vaccine. So this process actually goes back about a month or two ago, where providers, pharmacies, we as a county had to do this. We had to sign off that we wanted to accept vaccine and administer that under the COVID-19 pandemic. So, any provider, any pharmacy that was interested in doing that had to go through that process and become a designated site. If you actually go to the state website, I believe there's a spot that's showing the list of potential available vaccination sites. The problem is, at least earlier this week on the state site, it wasn't showing actually who had vaccine. It just showed the places where they were eligible to get vaccine, which created a lot of phone calls and I think frustration also. But the reality is pharmacies are starting to receive vaccine. We've heard in the region, obviously Wegmans, I believe some Tops, some Rite Aids have also started to receive the vaccine in some of those allocations. Just keep in mind, from our end, and whether it's a pharmacy or provider, they're kind of on their own, I guess. We're not overseeing that process on the local health department process or the health department side. They actually get it directly through their allocations, and they're responsible to set up their own clinics or calls, however they deem forward to move forward and administer the vaccine. We are trying to reach out to those that may have received it already this week in our counties to see exactly who has it and what their plans are, because we would like to help articulate that to the public so that message can get out again if they're going to set up a clinic and how they're going to have people sign up and register. But ultimately that again is being done technically directly between the state and pharmacies and the state and providers. Okay, any other questions? Matt looks bored. He looks like he wants a question.
If I may, it was a really good question about how do we help those who have trouble navigating a website in our older population. And I would encourage everyone just to be a really terrific neighbor and compassionate community member. If you know people that are in this situation, please extend yourself, extend your technological capabilities, and ask. Just ask if people do need help, because this is going to help us cross this mountain range that we have ahead of us of the vaccination process. Again, when this pandemic started, there were just an outpouring of help for each one of our community members and a check just to make sure that folks were okay, if their needs were being met. And we're back there again, reaching out and caring for our neighbors and our friends in our communities is increasingly important in assuring that this vaccination distribution goes well. Again, as Paul said, it is not going to be here today. It's not going to be here tomorrow, that the availability of the vaccine. It's going to be, as we experienced with our testing capacity, that took 7 months for us here in Genesee County to ramp up and to receive the capacity. So we know how to be patient, but we're not happy about being patient, right? So we will continue to advocate from the county level, from the health department, from the county managers, in and out of the control room. We absolutely are advocating constantly on behalf of every community member here. Be assured that we are not silent, but help us in being patient. And by all means, we appreciate the frustration and we appreciate the constant changing of the state website. Hang tough, be Genesee strong for us. Thank you.
Shelley's last comment reminded me of a question. A reader's asked a couple of times about the difference in, I think on the state website, the number of deaths reported and what we're reporting. Can somebody address that? Why the difference exists?
So Howard, are you talking about like in facilities or general overall number?
I guess there's the state website, or there's another website out there that's reporting somewhere in the area of 90 deaths in Genesee County, and I think we're reporting, I think now 37.
Yeah, I mean, I can't speak to unless you want to send over the website and the discrepancy there. So our local data is based upon, again, those that we know were positive cases and that have passed. So again, I'm not sure where that 90 number would be coming from.
Okay, thank you.
Yeah. Okay, I think we're all set on our end then. If there's no other questions, again, we're going to do our best to keep doing these and keep pushing information. Again, patients out there, we're going to get the messaging to you as quickly as we can when we have it. And, be safe out there. Continue to wear your mask. Continue to social distance. Continue to minimize non-essential gatherings. Even as we move forward and the vaccine starts to roll out. it's going to be some time. We still need to put in these interim control measures, right, to make sure we're not, again, spreading the virus around and keeping our numbers high. So, continue to seek out vaccine wherever you can if you're eligible, and, continue to do the safety measures that we've been practicing for so many months now. Thanks.